and to get settled. This meeting is being recorded for everyone's information. We're recording the webinar so that it can be shared later at a later date. This is Earth Day, as we all know, Earth Day 2026. This is Earth Day. The theme this year being Our Power, Our Planet. All right, I think most people who are joining have logged in already. I see 34 participants. Once again, welcome to everyone to this, the first webinar of the Laudato Si Movement New Jersey chapter. You might know or you may not know the New Jersey chapter was launched just late last year. And this is our first real activity. We have some other exciting things coming up this year, which you'll hear about in due course. So my name is Terry Thompson. I'm the host of the webinar, and I'm the coordinator of the New Jersey chapter. So here in the Garden State, we join with people all over the country and all over the world in commemorating Earth Day 2026. The theme of Earth Day this year, as I mentioned, is Our Power, Our Planet. And this theme focuses on accelerating the transition from energy systems that are based on fossil fuels and carbon emitting to energy systems based on renewable energy and clean electricity. Our speaker tonight, Dr. Elizabeth Chercheo, will share with us her insight on the health benefits that can come about from such a transition to clean energy. And we will see that when we practice care for creation, we are, at the same time, practicing care for human health. Before we get started, I would like to ask Anna Johnson to introduce herself and to share with us some housekeeping notes.
Hello,
Anna?
everyone. It is truly my honor to be with each of you on this Earth Day. And as yesterday we commemorated and remembered the passing of our dear Pope Francis, the first anniversary as well. And it just feels like a very monumental time to have those two dates coinciding so clearly. My name is Anna Johnson. I'm the Director of North America for the Laudato Si Movement. I have the honor and privilege of working closely with Terry and the other chapter leaders in moving forward along with other chapters across the country and the region. Uh, Major, huge congratulations to New Jersey for this first webinar. This is a huge thing to pull off your first event, to get mobilized to do this, and it's so exciting to have all of you here for this amazing event. It's being hosted on our North America Zoom account, so that everyone knows, and it is being recorded, as Terry made note of, for later use as well. Um, Participants' microphones will be switched off, but you can go ahead and ask questions in the chat. Feel free to engage within the chat with any questions you have for the speaker or for anybody else to help engage. Feel free to put also your city in the chat and where you're calling in from. As we continue to build community even across Zoom screens. The mission of the Laudato Si movement is to inspire and mobilize the Catholic community to care for our common home and to achieve climate and ecological justice in collaboration with all people of goodwill. It's pretty big work, but an exciting one and an honoring one to have you all here with it. The New Jersey chapter is one of the many local state chapters here in the United States and around the world that are helping us to fulfill that mission, as we are active in over 140 countries around the world. So, welcome into the movement. It's great to have you here with us. To learn more about the Laudato Si movement, I will drop a link into the chat box to that you can peruse at your pleasure. Now I'll pass it back to you, Terry.
Okay, thank you very much, Anna. And as Anna mentioned, the New Jersey chapter of LSM is one of many. We have several activities, exciting activities planned for this year. So to learn more about the New Jersey chapter, please go to our website. I'll also drop a link into the chat box for the New Jersey chapter's website. So now I would like to turn to Mike Sims, director in the office of the Diocese of Camden, and ask Mike to start us off with an opening prayer.
Thank you, Terry. Mindful of God's loving presence dwelling amongst us and within us, let's take a moment to be still. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. All-powerful God, you are present in the universe and in the smallest of your creatures. You embrace with your tenderness all that exists. Pour out upon us the power of your love, that we may protect life and beauty. Fill us with your peace, that we may live as brothers and sisters, harming no one. O God of the poor, help us to rescue the abandoned and forgotten of this earth, so precious in your eyes. Bring healing to our lives, that we may protect the world and not prey on it, that we may sow beauty, not pollution and destruction. Touch the hearts of those who look only for gain, at the expense of the poor and the earth. Teach us to discover the worth of each thing, to be filled with awe and contemplation, to recognize that we are profoundly united with every creature. And as we journey towards your infinite light, we thank you for being with us each day. Encourage us, we pray, in our struggle for justice, love, and peace. Amen. Father, and the Son, and the Holy Spirit. Amen.
Amen. Thank you very much, Mike. So now to get down to the nitty-gritty, it gives me great pleasure to introduce our speaker for this evening, Dr. Elizabeth Chercheo. Dr. Chercheo likes to be called Lisa, so I'm going to refer to her as Lisa. And she is an associate professor of medicine and the director of climate health at Cooper Medical School of Rowan University in Glassboro, New Jersey. She also serves as the associate program director of the Internal Medicine Residency and chairs the Physician Engagement and Women in Medicine Committee. Lisa completed her medical degree at Robert Wood Johnson Medical School and her residency at the Hospital of the University of Pennsylvania. Lisa is a board-certified general internist in the Department of Hospital Medicine, where she oversees faculty development and research. And as the director of climate health, she is responsible for integrating climate health content throughout the 4 years of medical school, into residency and into faculty development. I could go on and on, speaking about the titles that she holds and the committees that she serves on or chairs. But I think you get the idea. We really have a high-powered speaker here. Lisa's regional and national work focuses on climate health in medical education, on sustainable healthcare infrastructure, both locally and nationally, and on health policies at state and national level and health equity. Lisa has several grant-funded research projects and has published and lectured extensively. So Dr. Chercheo, Lisa, the floor is yours.
Thank you so much, Terry. And certainly less is more in this because there is so much to cover here. I will be going at a fairly good clip because each one of these subsections could spin off 10 lectures in and of themselves. But I want to start with land acknowledgments because out of reverence for history, people, and place, I want to acknowledge that I'm speaking from the ancestral land of the Lenni Lenape people, and they are the original inhabitants of this land. So this is our agenda. We're going to go through a bit of a grounding in Dilexite, Laudato Si, and then an all too quick background, and we'll cover some of these areas. I am, as my disclaimer, an internal medicine physician and a hospitalist. So I am taking care of people when they are already sick, when they are already presenting to the health system, and not in the upstream forum where really a lot of climate and environmental health plays out. So do keep that in the background. But just to note that there are references to care for creation, to stewardship throughout the Bible. These are just really a handful of some of the quotes, but it is part and parcel with our faith. This is a requirement of our faith. It's not just an Earth Day slogan. It's really a fundamental moral and ethical dimension that can't be ignored. And so while I approach this through a medical lens, you can certainly approach the environment and the needs of creation wherever you are, however it makes sense in your life, because they're all just different facets of the same diamond. And, the Pope Francis has said that a true ecological approach is always a social approach because you're marrying those questions of justice with debates about the environment so that you're hearing, as he would say, the cry of the earth and the cry of the poor together. And so, I think of this as concern for the environment also needs to be married to a true and deep love for neighbor. So you can't just say that you love going hiking, but you can't stand your neighbor next door. You truly have to reorient your entire perspective so that you think about the trees that you walk by and the birds you hear, our pets, even insects that we might just see as pests or annoyances, that we see everything as part of God's creation. And so fundamental to this discussion is really the intimate interconnection with our environment, with others. And this is what science tells us. It tells us that we are such stuff as stars are made of. But of course, it's also what our faith tells us, that we are all one body. And so in harming the world around us, we are in a quite literal way harming ourselves through plastic pollution, through air pollution, through extreme heat, through climate disasters. And, I really see climate health as an extension of the compassion that as a physician I'm called to, but certainly that our faith calls us to. Now, the World Health Organization, many medical organizations and societies have called out climate change as the biggest public health threat of the 21st century. But truly, I don't see this as a story of doom and gloom, but one of hope, which is very different than optimism, because optimism puts rose-colored glasses on and tries to see the bright side, and hope really embraces the brokenness and forges ahead on a path of healing. Pope Francis wrote in Laudato Si, hope would have us recognize that there is always a way out, that we can always redirect our steps, and that we can always solve our problems. So we're going to just touch briefly on first Dilexite, because this was Pope Leo the 16th, excuse me, 14th's first apostolic exhortation that really focused on the poor. And a key underpinning of this work is environmental justice, focusing on those who are poor, who don't have a voice. And I'll call out a couple of the statements because I think they're really important in this work. He said that some people would say our task is to pray and teach. And I have 6 kids. You may hear them in the background. If you do, I'm sorry. But if I was trying to just pray that my kids would get ready for school in the morning, it would never happen. So I have to be actively engaged. There's a very active element to this. And he also calls out that science and technology are a good. They are a universal good. And so we should recognize this. And there's a reason why there's a pontifical academy. There's a reason why there's benefit to including science and technology in our faith. Now, turning to Laudato Si, this was really an amazing document, and it's been recognized as such, not just by the Catholic community, but outside the Catholic community as well. Bill McKibben said that it was the most important document yet of this millennia. And Pankaj Mishra said it was arguably the most important piece of intellectual criticism in our time. And so I would certainly encourage people to dive into it more deeply because it goes through these three intertwined relationships with God, with our neighbor, and with the earth. And, I'll just highlight that our own Conference of Catholic Bishops has been very active in issues that are important to many of us and should be important to all of us. And so it's heartening to see letters that are sent out to our congressional leaders advocating for things of fundamental importance. Now, I want to highlight this because this is from Archbishop Desmond Tutu. And Western medicine's orientation has almost always been towards tertiary care, towards understanding this complex pathophysiologic pathway, mechanisms of disease. We go to surgical treatment. We're not really focused on medicine. And so, we need to reorient so that we are not just pulling people out of the river when they're already in the river downstream. We need to go upstream and find out what are those environmental and social determinants of health that are causing people to fall in the first place. And going back to my Catholic school education, I think about this as the mercy versus justice argument. And truly, you need both. You need mercy for the people who are in the river. For me, that the people who I'm seeing in the emergency room who are already sick, but we also need justice and go upstream and address all of these issues in the first place. Now, I often frame this in terms of climate health, in terms of what results from fossil fuel pollution, because you have both the greenhouse gases that lead to global warming and to extreme weather, extreme heat, but you also have all of the air pollutants that catalyze and accelerate disease. And then you also have petrochemicals in the form of plastics that cause further harm. Now, just from the heat impacts alone, not looking at floods or storms or anything like that, it's been estimated that just 10 companies, fossil fuel companies, have cost about $28 trillion. So just enormous harms. And the health harms are really under-recognized in all of this. You all may be familiar with the billion-dollar disasters that used to be reported by NOAA. They're no longer reported. But those only accounted for infrastructure damage. They only accounted for livestock and buildings and bridges down. They never accounted for public health harms, for individual health harms. And I think that's really important to reorient as we're having these discussions. There's certainly very significant economic impacts, and that's again a bigger topic for another time. But I do just want to highlight that the World Economic Forum, a lot of us in medicine have found these strange bedfellows with sustainable business, with economists. And this is just an example that economists, business see this as a problem because there's estimated to be about $12.5 trillion in economic losses just in the next few years, along with 14.5 million deaths, plus about another $1.1 trillion in healthcare costs. Again, because people are coming into the healthcare system getting sick from all of these impacts. Now, they looked at a slightly broader purview, but they didn't even include air pollution in that. And air pollution has significant impacts. And in fact, it contributes to 1 in 5 premature deaths globally. So really huge impacts. And some of those estimates range from about 8 million to about 14 million deaths annually. Now, if we look at planetary boundaries, I think this is a helpful structure to think about. You can see that we've actually transgressed many of these planetary boundaries. So, and from 2009, when it was first developed by the Rockstrom, by Rockstrom and the Stockholm Resilience Center, you can see that we went from 3 boundaries crossed to 9 boundaries crossed, just in the course of about 15 or so years. So a really, really quick trajectory, an unfortunate trajectory. You can see that Pope Francis has said that we can feel the desertification of soil almost as a physical ailment and the extinction of species as a painful disfigurement because we are so entwined with nature, with the land, and with others. I want to highlight this because this was a really helpful infographic, I think, for people to understand the depth and breadth of climate health impacts. Now, this was from the CDC. It's since been taken down off of the CDC website, but it does get at all of the impacts, whether we're talking about infectious disease or anxiety, mental health issues, solastalgia, and also forced migration and climate migrants. We're not going to touch on all of these in a very short amount of time, but we'll especially highlight heat and air pollution. So in terms of some of the air pollution deaths, this is not new. Actually, back in the 1700s, there were writers in London talking about how they needed more parks and more green space to help to clean the air, and that was just from wood burning. But in London, you can see that 40,000 people died just over the course of a week when the air pollution was so bad. And certainly, we shouldn't have this kind of tragedy happen to institute better policies that help public health. I alluded to the number of deaths, and while there is a range, all of the numbers agree that it is still the highest cause of death and disease globally, and we'll look at that a little bit more. So you can see here most of the deaths are coming from Southeast Asia, but actually in the year when we had the Canadian wildfires, Canada and the US had the biggest increase in particulate matter air pollution. And if we dial down a little bit from the international scale to the more local scale, we know, and this is not rocket science, that there is a huge discrepancy in life expectancy based on where you live. I treat patients in Camden, New Jersey. That's where Cooper is, and this is an environmental justice community. And where I live, it's a very different story. So this story plays out in every community, every state. This is just an example looking at life expectancy, and you can see the further south you go, and this is just at the county level, the life expectancy declines. Now, if we look at the individual patient level, because this is what I deal with most of the time, this is what I see on a daily basis. So there's a story of Ella. Ella was 9 years old when she passed away, and she's in London. She had 27 hospitalizations over a 3-year period, and her family noted that no physician ever brought up the fact that air pollution could be contributing to her death. But after she passed away, they reopened her case, and this was the first time after inquest that they ascribed air pollution as a cause of death. And now they do this routinely in the UK. We don't yet do this in the US, but I think it would be an important step because we do it for tobacco. When I have to sign a death certificate, I have to attest if I believe that tobacco smoke contributed to a patient's demise. So looking at the air quality life index, this is out of the University of Chicago, you can see again, just looked at another way, particulate matter air pollution, particulate matter 2.5 is the biggest contributor to limitations in life expectancy. And if you look at it from a study, this is from the Lancet, they look at the global burden of disease, which is an enormous database of 204 countries. And they document as well particulate matter air pollution being the leading contributor to global morbidity and mortality, even beyond hypertension and obesity and diabetes. If we look in New England Journal of Medicine, you can see in a Medicare population, so these are adults over 65 years of age, that as the air pollution gets worse, particulate matter and ozone, the mortality goes up. And it's a near linear association. So, like there's not many graphs in medicine that you see that kind of near linear association with air pollution and death. And of course, it affects not just the elderly, it affects us from womb to tomb. So it affects those that are not yet born because air pollution gets into our system. It can traverse our alveoli, our distal lung, into the bloodstream, and then it crosses the placenta and can lead to low birth weight, premature birth, stillbirth, and even in children, because they're still developing, it can have significant impacts on cognition and lung growth. Now, certainly the causes of air pollution differ. In New Jersey, about 40% of it is from transportation. But we have to think about immobile sources like incinerators and industry, and of course, wildfires and other fires that happen. Now, I'm going to be talking mostly about particulate matter and ozone, but certainly if you just look at the EPA criteria air pollutants, you know that carbon monoxide and lead are bad. So intuitively it's probably not a good thing to have particulate matter and nitrogen dioxide, all of these things on this list. There's an additional 188 hazardous air pollutants. And that includes things like asbestos and toluene, other things you don't want to be breathing. And I'll just refer you all to the State of the Air report, which is really helpful. It's in the United States, but it goes through at a county level, so you can really get more granular detail. Now, I'll just touch briefly on ozone. Ozone is particularly problematic because in the presence of heat and sunlight, so thinking about the summer months, it catalyzes the conversions of oxide of nitrogen and volatile organic compounds into ozone. And this is a bronchoscopy where we put a camera down into the bronchus and look at the lungs, and you can see on the right, that's angry and inflamed. That's after someone has inhaled ozone. The one on the left is much healthier. And as we saw in that New England Journal article, that near linear increase in mortality, you see all-cause circulatory and pulmonary deaths happen from chronic ozone exposure. You also have adverse birth outcomes, and you have impacts on reproductive health and cognition. Now, with particulate matter 2.5, what you're looking at, just to orient yourself here, is that's supposed to be the width of a human hair. The PM10, those little blue circles, that's 10 microns. So that might be the size of dust or pollen. It might make you cough or sneeze. Probably not big enough to get into your systemic circulation, but those little tiny, tiny PM 2.5, it's only 2.5 microns. So it's so tiny that it can traverse the alveoli, get into the systemic circulation, and cause all of these problems that you see here. And as an internal medicine physician, this is everything that I see: hypertension, dementia, diabetes, lung cancer, asthma. All of these things are driven by primarily inflammation and oxidative stress and changes in DNA and mitochondrial function, all the stuff that I like to nerd out about. But just remember inflammation. So this is just an image. This is taken from a group in India, the Lung Care Foundation. And you can see that this in the middle, this was a non-smoker. This was because of the pollution of breathing in biomass that's been combusted, or diesel fuel, and then the lung of a 14-year-old boy. So how this is already happening even at a very young age, and these tar deposits don't go away. And they cause significant lung dysfunction. Now, while we always think about lung disease as the first thing, really it's cardiovascular disease that has the biggest impact. And so globally, the pollution-related deaths, 2/3 of them are from cardiovascular disease. It's from half of them are about ischemic heart disease, so like heart attacks, and then about half are strokes. So really, when you start thinking about air pollution, you should be thinking about strokes and heart attacks. But we also need to think about lung cancer, because at a time when tobacco use is decreasing, we see an increase in the types of lung cancer, particularly related to non-smoking. That's lung adenocarcinoma. And there's really now interesting studies going into the pathophysiology, so that we're not just talking about an association, that the two things happen together, and it could be a coincidence. We have studies now showing exactly how particulate matter pollution leads to the circumstances that generates a lung adenocarcinoma. And that's really important for our understanding, for the science, but also for the evidence base as we talk about this. And importantly, I think we should also remember that this can be changed. So just as we were talking about this as being areas of hope and opportunity, if an individual moves into an area with cleaner air, their lung function can reverse within a week. They can be decreased clinic visits, absenteeism, cardiovascular disease mortality. All this can benefit just from moving into a cleaner community. And this has been demonstrated at the city level. This was in Pennsylvania, where they showed that there was actually decreased hospitalizations because of lung disease after a coal coking plant closed. So this is in a city, but then we also see at a country level, at a bigger scale, when Ireland banned coal, cardiovascular deaths dropped. Same thing in Hong Kong, you saw a drop in cardiovascular deaths. And in this kind of interesting in situ study that was done during the Summer Olympics, they had cordoned off this whole area around Atlanta, And when they did that, the air pollution improved by about 25% or so. And at the same time, the asthma admissions dropped about 44%. And then, of course, when the Olympics were over, traffic went back up and all of the asthma admissions went back up again. So there's a lot of things that we can do, and certainly, I would recommend people to talk to their physicians, their providers. Not everyone knows about this, that this is an area that we're still actively educating physicians and medical students and residents to think about this just the same as we would consider any other risk factor, like poor diet. Now I'm going to pivot to heat, and this is from the Climate Central, which is just up the street from us in Princeton, New Jersey. It's showing how heat has been increasing, and they have a version of this for all over the U.S. As we had mentioned, a lot of the really fundamental principles of climate health is that there are environmental justice issues at play here. And so there's individual susceptibility, people who are disproportionately going to be harmed if they're exposed, people with disabilities or comorbidities or multiple medications. But then we also have these vulnerabilities, things like what kind of job do they have? What's their health literacy? What's their housing status? Do they have access to air conditioning? All of these other factors that put them in harm's way. And so I'm just referring you to a couple of these New England Journal articles that really have wonderful graphics, but also try to highlight some of these issues for the broader medical community. And I'm sure many of you are familiar with redlining, or have heard about redlining. This is from an infographic from the New York Times, but you can see that in areas that were redlined, that were systemically disinvested in, those areas were hotter, they had less tree cover, and as a result, these individuals were exposed to very high temperatures in the summer. And we've now seen new conditions evolve from this. So Mesoamerican nephropathy was recently identified in Central America among sugarcane workers who were out working in the field for long periods of time, not drinking because they would be compensated based on how much they harvested. And they would return at the end of the day saying that it felt like they were urinating sand. And they had urate crystals, the same crystals that cause gout. And they had an increase in their creatinine numbers, which is not a good thing. And this was happening continually over and over again. So that whole communities of young men were developing chronic kidney disease and needing dialysis in an area where dialysis was not readily available. We see this, I have seen this in my own patients, particularly in migrant workers, migrant agricultural workers in particular, but we've seen it in many populations and not just in the US, or in North America. We see this all over, and there are many workers that we should be thinking about in this. Now, we'll often consider heat exhaustion, heat stroke, and certainly heat stroke is very, very dangerous, up to an 80% mortality. And there's few things in medicine that are quite that dangerous. But we also need to be thinking about all of these other manifestations. So I'll skip over some of this, but there was a really nice study done in Nature Medicine where they looked at the Mediterranean a few years ago because there was a really bad heat wave. And at the time in the news, they were reporting about 8 to 10,000 deaths. But then these researchers went in and they looked at the observed over expected. And what they found was that there was actually 61,000. They then revised it to 71,000 deaths, which is catastrophic. Over a couple weeks, 71,000 deaths from heat. And yet it very often doesn't make it to the news. We're often not thinking about this, but these are lives lost. And there are certainly vulnerable populations within that. We talked about the elderly and the very young, but we also need to think about pregnant women. We need to think about the fact that heat alters vasoactive substances, it affects endothelial cell function, and it results in stillbirth. It results in preeclampsia and hypertension and all of these things that we know are bad. And it results in teratogenesis, means that there's birth defects. So because this is why we tell women not to go into hot tubs, because when the heat exposure happens, that can disrupt gene activity that then triggers organs to develop. And of course, women in general are going to be more susceptible to heat exposures, in part because of the growing baby, but also because of gaining weight and everything that goes along with pregnancy. Um, We also need to think about the impacts of those defects, those congenital defects. And there was a study that is suggesting that just over the next few years now, we're going to see about another 2,600 cases of congenital heart defects just in the US because of heat exposure. And of course, a lot of this happens in populations that are already disproportionately harmed. So this was a systematic review where they were looking at outcomes with air pollution and heat. And that combination was particularly deleterious. And they found that minority women, those with low socioeconomic status, those living near power plants or highways, really had the worst outcomes, including stillbirth, premature birth, low birth weight. And so, again, there are things that we can do about this, things that I counsel my patients on, but advocacy and policy change are really the biggest thing that we can do to enact systematic change. And then I want to pivot to plastics. So I'm sure you all have heard about the equivalent of a credit card of plastics every week, probably a bit of an overestimate. But plastics are pervasive and they are increasing. They're expected to double by 2040 and to triple by 2060. And it's a very it's a very explicit campaign. So the fossil fuel industry doesn't hide this because as clean energy starts to become cheaper, they have to have an output for their product. And so they've been trying to increase plastics. We know that it's present in every liter of bottled water, and we know that it's present in probably all Americans. A lot of it is from disposables. And right now, plastics end up being about 2 times the mass of all living animals. And Pope Leo has highlighted how we are neighbors on this planet, and so we are responsible for one another's well-being. I just want to highlight here the 63 or so different, this is just a sampling, different tissues that plastics have been identified in. And this is in breast milk, in placenta, in the brain, in the blood, in the sputum, in the lung, everywhere. And we breathe it in. We have dietary intake, and we also absorb it through our skin. So it's really hard to get away from because it is so pervasive. And we often talk about these microplastics and petrochemicals as being endocrine disruptors. And so, because they affect our endocrine system, our hormones, they affect us throughout our lifespan, from womb to tomb again. And particularly, they're associated with decreased sperm count and quality. They're associated with obesity, high cholesterol, diabetes, and with cancers. So, in my grandmother's generation, there was about a 1 in 50 chance of breast cancer. In my mother's generation, it was 1 in 25. And in my generation, it's 1 in 8. So, you don't see that kind of acceleration in cancer risk because of, evolutionary change. And there are some other really interesting studies looking at what plastics can do. So plastics in the carotid artery has been associated with about almost a 5-fold increased risk of death, heart attacks, and stroke. This was from an Italian study. And this is what we call the arrow sign in medicine. So these little jagged microplastic particles led to inflammation around it and led to that inflammation triggered a lot of those bad outcomes. And in another study that got a lot of press, there was a plastic spoon in the brain. It was in New York Times. It was in everywhere. The brain actually seemed to be concentrating plastics. That they looked at decedents' brain, liver, and kidney. And not only was there about almost a plastic spoon worth of plastic in our brains, but it increased about 50% from 2016 to 2024. And again, you can see some of the examples here of what that looks like. I want to pivot now because a lot of that stuff is heavy. I want to pivot to nature prescription programs because it is in our DNA. It is in our nature to be part of nature. Only in the past couple centuries have we really been living within the 4 walls of buildings. And I want to tell you about forest therapy. This Shinrin-yoku, which was coined in Japan, but subsequently it's been really caught on in Canada, in Scandinavian countries, and it really just involves being out in nature, which would seem to be second nature, but of course we have to study it. So it's been associated with stress reduction in terms of lower cortisol levels, lower epinephrine, norepinephrine levels. It enhances our immune function, and we have a whole host of health benefits. decreased blood pressure, decreased heart rate, improved heart rate variability, which is a good thing, decreases depression, all of these benefits just from spending time out in nature. So now there's a move to have physicians actually write out on a prescription pad, you will go out into nature 20 minutes 3 times a week. And some of it is certainly the activity, but a lot of it is actually thought to derive from these other impacts like phytoncides and terpenes. So these are substances that are identified within the tree trunk, within the leaves, particularly of old growth forests. And a lot of these have antimicrobial impacts. They might have antispasmodic impacts in the GI tract. They help to decrease cough and nausea. And this shouldn't be a surprise because, 60% of our pharmaceuticals are plant derived. And we've really only interrogated from a pharmacological perspective about 5 or 10% or so of the plants out there. And so I want to end with a story, if I can. This is Pai. He is from the Amazon. And before the last COP, which was held in Brazil, he was the only journalist that was invited to interview Antonio Guterres, the UN Secretary General. And so if you'll indulge me, I want to read a little bit of what he had said. And this is about moths. We were talking in the beginning about insects and seeing them as pests, but I'm a young indigenous man from the Japai people. In the linear time calculations of the non-indigenous, I'm 19 years old. I had lived my whole life in my village in a Japaya indigenous territory without ever spending more than a month in a city until I moved to Altamira, a deforested city in the Amazon. Altamira seems like a place where souls have gotten lost. People live like turtles locked inside their shells. They avoid each other's faces as if fleeing from a mirror. Amid the potholed streets, I realized deforestation isn't only about trees. Our vision, our hearing, even our presence can become deforested as well. And then he says, I listen to the moths because they are people too. If you're not indigenous, the statement might sound odd, but if you were a member of my ethnic group, at some point in your life, you would have heard from an elder, or maybe while reading one of my people's stories, armadillos when they were people, or this is the song caterpillars sang when they were people. The phrase when they were people doesn't mean that they're no longer people, only that they are no longer people in the same body as ours, like they were before. Now they're people in bodies different from ours, with lives different from ours. That's why I decided to listen to moth persons. And he's writing about an experience he had in the supermarket here. The moth was dead, but its body intact, and I watched from a distance, wondering who among all those people would notice her first, or at least exclaim, "Oh, a moth." I had even greater hopes. I wanted to see who would pick up the moth, carry her over to the roots of 2 plants in front of the supermarket so she could dissolve into the soil where greenery rooted in permeable pavers finds room to breathe. But just as I had finished this thought, a man's boots crushed the moth. Impassive, he got into a car and drove off. I looked away and crossed the street. I thought about the moth all day. That evening, when I was returning from work, she was still there, even more crushed. I picked her up and carried her over to the plant and buried her among the leaves. Recently my mother passed away, and we had a natural burial for her. There was no embalming. It was just a cotton gown and a pine coffin that would quickly dissolve and return into nature. We had these elaborate steel boxes and formaldehyde and methanol, all of these embalming chemicals, and we fight against nature even in death rather than just letting ourselves gracefully reabsorb back into nature. And so I will close there. I certainly welcome any questions from the group, and I have some resources up here if people are interested in learning more, either as a patient or as a healthcare provider. And thank you so much.
Well, that was really a fantastic talk. Yes. Yes, I applaud you for that. Some of the things you said were very scary, to be honest with you. But you also gave us reason to hope. So speaking to the participants now, if you have questions for Dr. Chercheo or Lisa, please type them into the chat box. and we will get to them at the end. So before we get to those questions, I would like to ask Glenn Miller to briefly give us some insight as to what this all means for public policy here in the state of New Jersey. What are the legal, the legislative, and the policy issues, related to air pollution, to conversion of energy systems, and so forth. Glenn is our coordinator for advocacy in the New Jersey chapter of Laudato Si Movement. So everyone, likewise, if you have questions for Lisa, for Dr. Churcheo, please put them in the chat box. But also if you have questions for Glenn, when you hear what he has to say, please put them in the chat box as well.
Well,
Okay,
thank
Glenn,
you,
over to
Terry.
you.
Thank you, Terry, and thank you, Lisa, for that wonderful presentation. There's so much useful information, and um, just thank you so much. Terry, I don't know if I'm going to cover exactly what you asked me to, and the part about it being brief is going to be difficult for me too. I was a professor for 35 years, so you give me a topic and an audience, and it's like automatically 100 minutes. That's just what happens. But I'll go as quickly as I can, as Lisa did as well. Um, so. Um, our chapter, our New Jersey Laudato Si Movement chapter, has three pillars: spirituality, education, and advocacy. And Terry's asked me to speak of advocacy, but as we know from Laudato Si, everything is interconnected. So I'm going to start by making a connection between spirituality and advocacy. Oh, so um, I'm a lector. If any of you are thinking about becoming a lector, I so highly encourage you to do so. One of the best parts is they give you this wonderful resource that gives you the backstory about the passage that you're going to read that week. And so last week, I read this passage from Acts. Hopefully you heard it. So Peter is preaching to a large, mostly Jewish gathering, asking them to believe in Jesus as the Lord and Messiah based on the miracles, wonders, and signs they have heard and seen, and by citing the prophets who foretold of these events. So everyone in the pew looks happy. Oh, that's a good reading. But the backstory is amazing. So the backstory is the apostles were in the upper room and they're sitting around in wonderment and awe at the resurrection of our Lord Jesus Christ. But also, it's not that far from Good Friday, and they saw what happened to Jesus. And it's during Passover, so there's a huge crowds out in the streets, and they're very, very fearful. So just the very fact that Peter goes out and gives this talk is just such an amazing act of courage. And I use it sort of metaphorically as what our role is as advocates. So I find often that we're in these meetings with other like-minded individuals, sort of preaching to the choir, and it's time for us to be courageous and go out and get this message to people who may or may not be like-minded. And there's the t-shirt version of it, faith over fear. So back to exactly what Peter said to them to try to persuade them to believe. And again, I'm speaking somewhat metaphorically. So he asked them to discern based on what they had heard and seen. If you get a chance, read the book by Catherine Hayhoe about how to talk to people about climate change. And as I heard Anna say earlier today, everyone has been affected by climate change at this point in time. So sort of hit them where they are. If they're farmers, you can talk to them about what they've seen going on with their crops. just I can't tell you how many times a simple conversation about the small talk of the weather has turned into me getting into a deep discussion of climate change with someone. And then he asked them to consider what the prophets had said and how what had transpired closely matched what the prophets had said. Now, again, speaking metaphorically, Lisa and the scientists are our prophets, right? And so this is what we need to do. We need to get this information that Lisa has out into the population at large. How do we do that? I wish I had the simple answer to that. So how do we get out of our silos? Social media, whenever we talk about youth programs, the first thing that comes to mind is social media, but we all know of the silo effect and the echo chamber effect that is there. So I would advocate instead for putting more information about the environment in religious education and in the science curriculum in our schools, especially Catholic schools. Now, I would say, where do we find these people who are not so like-minded? Well, they're in the pew next to you, folks. If you saw the 60-minute piece, I put the link to it there. The moderator said that 55% of Catholics voted for someone who later called climate change a hoax. So a good place to start is right there in our own churches. And it's actually why I joined the Laudato Si New Jersey chapter was because I saw it as a place where I could begin to disseminate the work that we do on parish at the parish level, so that more Catholics can see what can be done, the small steps that we can take to change people's hearts. So here's, I call it my picture of love. We have our creation care garden where we grow a lot of vegetables and put it in the food bank. So, my priest will send email blasts with this, and people see it and they come and talk to me, and we have good conversations. Advocacy is, always talk to Terry about this. We've got to increase the number of people, and we're not going to do that by talking among ourselves. So we've got to, that's how the politicians work. These, talk about redistricting and all these political campaigns are driven by statistics and the number of people on one side or the other of the issue. So we've got to change one heart at a time to get those numbers up. But those little acts are not enough in order to make the kind of change that will make it possible to have a world where fossil fuels are no longer our primary source of energy. We're going to have to change environmental policies, and that's sort of what Terry has asked me to speak about. And so I'll highlight two of the issues that we're currently working on in the chapter, and I will be sending out action alerts, and I hope that you're registered with our chapter so that you will get these action alerts when I send them out. Coming up soon, we're hoping that we can get this on the legislators' agenda in the next month or so. The New Jersey Make Polluters Pay Act, which will set up a fund that the fossil fuel companies will be mandated to put money into to pay for damages caused by climate change. And I don't think, Lisa, that they're talking about these health effects yet that you've talked about. So they're talking about just physical damage, as you said in your talk, bridges and such that get taken out by floods. But it's a start when the fossil fuel companies are held accountable for the damage that they cause and held accountable economically. That's how they turned around the tobacco industry, right? So this is a good place to start. As upcoming rally, I will send out an action alert for that. And the other issue that is really just egregious, the Nessie Pipeline project, when they did the environmental impact study, 3 times it was turned down because of the huge impact on health as well as the environment. And finally, it just got pushed through. But there's still a chance to stop it. There are other ways. It has to still go through a couple more approval processes. So I put the statistic there for how much CO2 will be emitted every year, and at least imagine the health impact of living near a compressor station that puts out 130,000 tons of CO2 and a host of other gases and chemicals as well. So that was my brief version. And now, Terry, I guess back to you. We can have questions.
Sorry, I was muted there. So yeah, thank you very much, Glenn, for your insight on policy and legislative issues. So again, everyone, if you have questions, a few questions have come up, but if anyone has questions either for Lisa or for Glenn, please put them in the chat box. Yeah, I have a couple of questions for Lisa already. So Lisa, here's the first question. How are healthcare systems educating their doctors about this information so that they can share it with patients and point towards the relative causes of harm in the patient rooms? And is there any way that we can support in educating our doctors when we have our appointments?
Thank you for the question. Goodness, that I could go on and on about this. You guys could get the hook for me. So I started dropping in part of this, that there was an article that I recently wrote on how we should be having our accrediting bodies, the national accrediting bodies for residency include climate health, education as really a key pillar. And we did this during the opiate epidemic. We changed the requirements such that opiate education was mandated. And so right now doing a lot of work over the past month or so about including this in ACGME. But as you all know, with advocacy, it's an uphill slog. So none of this happens over the short term, but it's continual. With medical school education, a lot of us have been working in this space for years. And I will say it's increased from about 30%, maybe like 6, 7 years ago to about 70% in 2023. This was from the AAMC, and this is the Association for Medical Colleges. So that's already a huge win. Not to say that, we could still do better because, it could just mean that it's mentioned one time in one lecture. It really needs to be integrated throughout and seen to be on par with other factors. So the education is a huge issue. That's not even touching on how we need to educate our faculty, because as we educate our younger physicians, we have a lot of seasoned faculty who have never heard this, and people tend to get a little bit set in their ways, and so like they're not necessarily totally excited about learning an entire new field of medicine. But we try to get people excited about it. In terms of patient care, there's let me drop this other link into the chat. So this was a study that I recently finished between Cooper and I was working with a friend of mine in Maine. And what we found was that actually 84% of the patients recognized that there were climate health impacts on their health, on why they were in the hospital. 84% is a lot higher than a lot of the other surveys out there, but they didn't study an inpatient, a very sick population. So people, when you ask them the question, they can make those linkages. And then we ask them, if they would download apps like the OSHA NIOSH app for heat and the Air Now app for air quality. About 50% of them said that they would. So, that's something, but we still have a lot more to do in terms of education to, again, going back to the river analogy, we need to keep people healthy, but we also need to motivate people to make changes. And there's a website, climaterx.org, and for clinicians, they'll send out a badge, and And if you don't have time in the clinical encounter, people can just scan that badge and it'll take them to some climate health resources. And then there's also VODR, and this is another badge that we can wear because like we all have to wear our doctor badge. So this is another badge with a QR code that will take patients so that they can register to vote. And, these are simple things that we can build in. Talking about voting as a social determinant of health. Voting is really critical and people feel disempowered, but recognizing that this is something that they can do to change their health outcomes.
All right, thank you. Thank you very much. Lisa, here's another question about natural burials.
Mm-hmm.
So there's a question just how can people get more information about
Yeah.
planning natural burial?
Yeah. I actually heard about this from an NPR piece. There's not a lot of places in New Jersey that do natural burials. Cremation, it contributes to air pollution too. It's energy intensive. But natural burials are wonderful. And so I would say probably just Google it. You can certainly reach out to me offline. I can give you more information on it from my research. But it's such a beautiful, simple, holistic way of approaching the end of all of our lives.
Okay, thank you very much. I see a few people are starting to drop out of the webinar, just for the people who are still with us, which is the majority. We're planning to wrap up by 8:15, so if you can stay with us 10 or 12 more minutes, you'll get the whole shebang. Lisa, I have a question for you. So you talked about how exposure to air pollution increases the risk of cancer and cardiovascular diseases. Is it also true that it can make people more vulnerable to bacterial and viral infections in the respiratory system? And
Yeah.
a follow-up question, I'm assuming the answer is yes. What is the mechanism? Why does that happen?
Yeah. So, this has been known for decades, really. Like, we've known in children in particular, risks for ear infections, for pneumonia, for upper respiratory infections, because pneumonia is a lower respiratory tract infection. We've known that this is worse in the setting of exposure to air pollution. And then this was just amplified with COVID. We saw on a global scale, we saw these studies coming out from an epidemiologic perspective of how increases in air pollution increased both susceptibility and acquisition of COVID and also mortality rates from COVID. So that it kind of threw into stark relief the impacts that air pollution can have. And a lot of it goes back to inflammation again. So when you have inflammation in the airways, you're going to be more susceptible to infections. And the same thing happens, we'll have, there's like a classic board type of question when you have someone present with a viral pneumonia and they're starting to get better and then they get sick again. And it's because they got a bacterial pneumonia. Well, they were set up for that bacterial pneumonia because of all the inflammation that was triggered by the viral pneumonia in the first place. So we have a pathophysiologic understanding of why that happens.
Okay, thank you. Thank you very much. So you've talked about, all the risks associated with air pollution. You did not mention one statistic that I looked up recently, and it is according to the World Health Organization, nearly 99% of the global population breathes air that exceeds WHO air quality limits. The exposure to unsafe air containing high level of pollutants is, unsurprisingly, most severe in low and middle income countries. But can you tell us how it is here in the state of New Jersey?
Yeah.
Of course, it will vary between rural and urban and so forth, but can you kind of give us the picture? How safe is the air that we breathe? I mean, the people here in this webinar.
Yeah. I mean, as you alluded to, not so safe. So, the WHO threshold for particulate matter is about 5. In just a couple years ago, particulate matter 2.5, the threshold was 12, and then it got lowered to 9 in the last administration. But that's still not so great. And in fact, there's no safe cutoff. It's like how much poison do you want to drink? Like what's the safe amount? So there is no level of particulate matter that has not been associated with adverse cardiovascular outcomes, for example. And New Jersey is no different. We have Superfund sites, not the good Superfund bill that we're trying to advocate for, but sites that are pollution heavy. That we have our own cancer alleys in New Jersey. I was just talking to my residents about it earlier on today. A site identified in New Jersey. So certainly we have no safe level, and we also have to think about the indoor air, as we don't necessarily even get respite when we're indoors because we are surrounded by plasticizers and volatile organic compounds. And so, we may think that going indoors helps everything, but unless you actually test the air, it might not be any safer inside. And certainly, if you are able to go out into the green and the peace, that's wonderful. But farms, if they are spraying pesticides and fungicides, herbicides, that's not so great either. So, and I don't mean to have this as again, like a story of doom and gloom. I think it should make us appreciate every aspect of nature, and we can't live wrapped in bubble tape. So, everything that we do is going to have impacts on ourselves and on others. Just existing means that someone or something else can't live, and maybe it's the salad that I had for dinner. There are plants, there are animals that aren't living because of my existence. And so, I think we have to do what we can in any way we can, as intentionally as we can, but recognize that we're all part of this ecosystem as well. I don't know if that helps.
It does help. In fact, I'm happy that you mentioned the indoor air pollution because there was a question about that. But whether we're talking about indoor air or outdoor air, we see that this is a problem that is not very far from us. This is not a problem that's, affecting some hypothetical other. It's a problem that's very real to us right here in the state of New Jersey and to all of us that are listening in on this webinar. But you also have mentioned that there is reason for hope. As people of faith, we are called to hope and to love in the face of these fears. And we thank God for the guidance and the inspiration, I think, that has been given to us through Pope Francis' Laudato Si encyclical. And frankly, the U.S. Conference of Catholic Bishops, have really gotten behind this issue too and are amplifying it. So that's something to be thankful for. We're coming near to the end. We do have one question for Glenn. And Glenn, the question is whether you have any strategies for starting those conversations about climate change with our neighbors in the pew, who might be reticent to hear it.
Just what I mentioned. Talk about, get to know the person. Talk about the weather, how climate has affected them personally. The price of groceries. Things like that can lead to very fruitful conversations about the choices that are being made for us and by us. Sorry, but I just wanted to talk about what you said a minute ago about, our faith and what we believe as Catholics is we believe in the sanctity of human life. And these projects like the Nessie pipeline, I gave you the numbers and do the math, right? That much pollution coming out is going to have what effect on mortality? And we're talking about actual human life, which we believe to be sacred. And so, and again, the other strategy I would have is to start a creation care team in your parish and do little non-controversial things like gardening and have events, and people pop up and start conversations. And to me, those conversations end in talking about the damage that fossil fuels do and the alternatives to fossil fuels and how to invest in those alternatives and how to advocate for our governments to invest in those alternatives.
Okay, thank you. Thank you very much, Glenn. So that's just about all that we have time for. We're going to wrap it up now. I thank everyone for participating. To Lisa and to Glenn, you've certainly given us a lot to think about. I know I learned a lot tonight. I want to thank you both for the informative talks that have clarified for us the connection between energy systems, climate, pollution, and health. Thank you, Glenn, for sharing your insight on the policy and legislative issues. And many thanks to Anna Johnson for hosting this webinar on Laudato Si Movement's Zoom platform. Everyone who hears me, please check our website to keep informed about all the interesting things that the chapter in New Jersey is doing. I put the chapter's website address in the chat earlier, but frankly, you can just Google Laudato Si Movement New Jersey chapter, and you will find it. If you registered for this webinar, we have your email address. We're going to put your email address into our listserv, unless you have any objection. And if you do have an objection, please let us know. Otherwise, we're going to go ahead with that. Last thing I want to say is I'm putting into the chat box now our email address. Just excuse me 1 minute. Yep, so you can see it in the chat box there. You can get in touch with us this way. The New Jersey chapter plans to come out with a periodic newsletter in the near future. If you would like to receive the newsletter, just send an email to the email address you see there, and we'll put you in the newsletter mailing list. So I think that's all we have time for. It's really been great. I feel very excited that we've had a successful webinar. Thank everyone for their participation. As I said, especially the speakers. So good night, everyone, and happy Earth Day.
Thank you. Happy Earth
Happy
Day.
Earth
Good
Day.
night.
Laudato
Happy Earth
Si.
Day.
Thank you.